Despite some concerns, an FDA advisory committee unanimously voted to recommend a half dose of the Moderna COVID-19 vaccine as a booster shot for seniors and at-risk groups. One concern was that the sample sizes in the data presented just wasn't big enough or explained well enough.
So I just want to explain why I voted yes on it as more gut feeling rather than based on really, truly serious data.
Locally, emergency physician and head of research operations for Centura Health, Dr. Michael Rashan, said the recommendation was the right call.
We have to look at the data. We have to make a few assumptions and frankly, weigh the risk of acting in the face of imperfect data with the risk of not acting when the data is fairly convincing that it is helpful.
Also in Thursday's meeting, one member of the FDA panel pointed to the president's set after approving booster shots for the Pfizer vaccine.
I think from a pragmatic point of view, even with what I just said, in some ways I support this EUA because we've already approved it for Pfizer, and I don't see how we can possibly not approve it for Moderna.
Dr. Rashan says he believes the vaccines have already been proven to be safe and effective, and so because the recommendations is limited to certain groups, it makes the case to recommend a booster stronger.
I think it's key to remember they have to weigh the balance of good with the potential for balance of harm. We know what to look for to determine whether or not it's likely to be effective. So as we get farther and farther along and understand the biology of the virus and the biology of the vaccine better, we can draw more strong conclusions from even smaller studies.
Luis De Leon, 9 News.
Tomorrow, the FDA will consider a booster for the J&J shot, but also discuss mixing and matching vaccines for boosters. Dr. Rashan tells us he's seen patients mix and match already, and based on what he's seen so far, it's been effective.